Today I'm wearing a tie from Terra State Community College in Fremont. Terra State offers more than 60 degrees and certificates and has been educating students now for more than 50 years. We just learned that the Ohio Department of Rehabilitation and Corrections has experienced a tragedy. To date, around 10 a.m., the Correction Reception Center received notification that Dr. Craig Cullen of Lakewood was killed. The incident is unrelated to COVID and is under investigation by the Lakewood, Ohio Police Department. Dr. Cullen, graduate of Harvard and UCLA, a retired lieutenant colonel for the U.S. Army, a 10-year employee for the Ohio Department of Rehabilitation and Corrections. I'm told that his work ethic and dedication to his job and to the people was unparalleled. 80 years old, he drove from Lakewood to the Reception Center in Orient, long, long ways, every day, a 4-hour round trip. Our deepest condolences go out to his loved ones and to those who worked with him. Well, we've talked for many months about what happens when someone gets COVID-19. Our doctors and our medical authorities continue to learn more every single day. American Journal of Cardiology published an analysis last month that addresses the impact of coronavirus on the heart. And so we thought we would look at this a little bit today through the eyes of an expert. This issue also came up this week in some news accounts involving the Big Ten's decision not to have fall sports. So there's been stories in the media in regard to that. Ohio State has been routinely testing their athletes as part of their protocol. So today I'd like to introduce Dr. Kurt Daniels, who is a cardiologist, is going to share what they've been seeing at Ohio State about COVID's effects on individuals and also specifically on athletes. Dr. Daniels is director of the Adolescent and Adult Congenital Heart Disease Program and professor of Clinical Internal Medicine and Pediatrics at The Ohio State University and Nationwide Children's Hospital. Dr. Daniels specializes in congenital heart disease and sports cardiology. Dr. Daniels, thank you very much for joining us.
Hey, thank you for having me.
Well, Doctor, I wonder if you could just kind of tell us a little bit about what we know now in regard to the coronavirus and what impact it does have or might have on someone who has the coronavirus.
Sure, absolutely. The concern of late has been the diagnosis of myocarditis with coronavirus. And myocarditis is inflammation of the heart muscle, typically caused by viruses. This is not new to coronavirus. We've known about myocarditis and viruses causing myocarditis for many years and decades, but it's become heightened recently because of coronavirus. And there appears to be a somewhat higher rate of cardiac involvement causing myocarditis with coronavirus and other viruses so far from the data we have. And this is mostly in hospitalized patients. It's also important to know about myocarditis. There's a wide range of a clinical spectrum with the disease process. You can have very mild myocarditis affecting a small part of your heart and having virtually no symptoms, to having a large degree of your heart affected by inflammation, affecting the strength of your heart and your heart even failing. And one of the concerns around this process is arrhythmias. We know that if the heart is inflamed, that there's a chance of having increased electrical activity of the heart, and this could cause dangerous heart rhythm problems and even sudden cardiac death.
And doctor, I wonder if, thanks for that explanation. And so do we know how often someone who has coronavirus, it impacts their heart? Do we have any data on that yet or not?
Well, most of the data we have is from hospitalized patients, and that's pretty clear. And when you look at samples of hospitalized patients, there's data that would suggest as high as 20% of the hospitalized patients, our sickest patients with coronavirus, may have cardiac involvement. as patients in the community or people in the community with coronavirus, we know less about that. There is emerging data, and we're trying to analyze that data and trying to better understand it. But we certainly don't know the impact out in the community when people have less symptoms or less affected by coronavirus.
Now, Doctor, I know you and I talked last night, and I know you were involved in kind of monitoring some of the athletes, and you have described what I would call kind of a vigorous protocol in regard to testing. And so I wonder with the athletes, and so I wonder if you maybe can describe for us, without obviously using any names or giving big numbers or anything, or small numbers, but just kind of describe what you all have learned during that period of time.
Sure. Well, we've looked at a number of athletes from various levels of competition that have come our way because of coronavirus and the concern for the heart. And we decided to do a very extensive protocol, as you mentioned. And we have found myocarditis in athletes through our testing. The percent continues to change as we see more, but it's somewhere around 10% to 13% of those we've tested of various levels, again, of competition throughout. So we do know that this does happen, and it happens in the community with athletes. And we're still not sure of, again, the overall impact of what that means. And again, we continue to get more data, but it certainly is something we are finding.
So just so I understand and our viewers understand, Doctor, you talked about 10 to 13%. Is that 10 to 13% of those athletes, young men and women who actually tested positive? So is it 10 to 13% of those who test positive for the coronavirus had this myocarditis?
That's 10 to 13% of those that tested positive that were sent our way. So there's certainly ones that may not have come our way, so we don't know the denominator in that group. But certainly from the ones we evaluated with very sensitive testing, we found evidence of inflammation.
And in those cases, what was the range on that? Were those mostly mild, or how were they?
They were all mild cases. Correct.
Yeah. I wonder if you could describe, let's take this obviously beyond the setting of Ohio State and the Ohio State athletes that were being tested and you all were monitoring, but let's take it out into the world of high school athletes, but also for anybody who might, want to run at 25 years old, 30 years old, and they came down with the coronavirus. What should they watch for if they know that they've had the virus and they're coming out of the virus in regard to the heart?
Sure. Yeah, the reason why athletic competition and athletes is being mentioned, because we know there's a risk with athletic competition with myocarditis. There are what we call sudden cardiac death registries in athletes that have been well established that have shown that one of the causes is myocarditis. And this is old information that continues to, again, evolve outside of coronavirus. So we know that being an athlete and having high, intense competition and training probably induces a higher level of arrhythmia burden, that the exciting of the heart, the stressing of the heart, and if the heart is vulnerable with inflammation, then there's a risk of a dangerous heart rhythm problem. So it's not just athletes and those that are in athletic competition, but anybody who is at a high level of intense exercise could be at risk. Whether you're a triathlete or working out at a gym or whatever your competition or what you're doing on your own, you could potentially be at risk because of the level of activity related to the inflammation and the arrhythmia.
So let's just make up a case. Let's say there's a 30-year-old or 15-year-old, either one, who has been diagnosed, who's been tested and found to have coronavirus. They come out of that. They feel better. What is there a protocol that should be followed in regard to specifically their heart? Just maybe stay focused on this.
Yeah. Well, I say, first of all, when you have viral symptoms at early phase, you should rest. There's data to suggest that in that early phase, in the most significant phase of inflammation, it's important to rest and not try to physically exert yourself until your viral symptoms are gone. I think at least that quarantine time, and even after that, for weeks, you should be aware of symptoms. And what I mean by that is cardiac symptoms. So if you ever develop chest pain, shortness of breath, trouble breathing with any activity, palpitations, funny heartbeats, lightheadedness, dizziness, or passing out, obviously you should have some evaluation. So be aware of symptoms. You should gradually increase your exercise activity. And if you, as you do that, again, be aware of symptoms. And any time during that process you have symptoms, you should be evaluated. So any significant cardiac symptoms, and even those that have significant viral symptoms, meaning prolonged fever, bed rest, and we certainly in our hospitalized patients, we're evaluating their heart, but if somebody's at home and really has significant viral symptoms, they may need a heart evaluation before they go back to rigorous activity. But please be aware of those symptoms and have those symptoms evaluated before you go back and gradually go back into activity.
And is there any kind of clearance? You and I talked last night maybe about a clearance protocol. Do you have any additional comments about that? I mean,
well, I think it's
giving people guidance. I know the best advice is see their own doctor, but we do have people watching this, and you have an opportunity to kind of talk to them. So is there anything else that, as far as clearance before they go back and go run their 5 miles or whatever they're going to do?
Yeah, I mean, I think this is evolving, as you pointed out, evolving science, and we're learning more. And there will be a need for cardiac clearance for many to go back to their activity, whether it's organized or unorganized sports. And that level of clearance is dependent on the age of the patient, probably the activity they're doing, and their symptoms. And there's early protocols now, and I call them early because they probably will be adapted over time as we get more information. But there's protocols for kids and adults that says this is how we best, today at least, should clear them back to activity and sport. And I think, again, as time goes on, this will continue to be adapted as we have more information. That level of clearance and what is done is going to be determined by the provider, again, based on age, activity, and symptoms.
Okay, good. Doctor, thanks for coming. Thanks for sharing this information with us. We appreciate it very much.
Thank you.
Eric, we'll go look at the data slides right now. Our first one is kind of our regular slide, our key indicators. Cases have gone down. They've been hovering around 1,200. The day before yesterday was higher. Yesterday is 1,178 cases. That's a little bit below the 21-day average, but really kind of hovering right there. 21 deaths, 122 hospitalizations. That is up a little bit. And ICU admissions is up a little bit as well. Eric, we'll go to the next one. We continue to rank our counties. This is updated from Tuesday by highest occurrence. And remember, the way we do this, we're trying to compare apples to apples and trying to adjust, we do adjust for population by county. So what we're trying to see is what is the intensity during the last 2 weeks of the COVID spread and COVID cases in the county. And so, Eric, why don't let's go over to our top 10. A little easier to read. I think what Mercer County is still number one. Champaign County is number 2, and Lawrence County 3, and Darke County number 4. So the first 4 counties are what we would normally consider rural counties. If you go through the rest of the list, you do see Lucas, a bigger county, and Franklin, but you also see Perry County, Meigs County, and Seneca County, as well as Fairfield, smaller counties. So this is just one more way to look at it. Again, it is not a long historical look back. It is a look back for the last 2 weeks. And of course, every day these numbers change a little bit as we go back for the 14 days. But again, it gives you one other way besides the color to look at what's going on in the area, in where you live. Eric, let's take a look at the next one. Our Ohio National Guard continues to go around the state and do what we call pop-up testing, testing for one day going into the community. You'll see this week, had the opportunity to be in Cincinnati, in Gallia County, Athens County, Cincinnati, and Dayton. Next week, a much more busier schedule. Bucyrus, Cincinnati, Dayton, Avon Lake, Cincinnati, Youngstown, Avon Lake again, Lima, Cincinnati, Warren, and Middletown. And so again, if you have in your community, if you believe that there's additional testing that needs to be done, the National Guard can come in and do that testing. Eric, let's go to our color map again. This is a new map for today. And let me kind of go through this. This week we have 12 red counties. 3 new counties have turned red since last week. The new counties, 2 of them are in Southwest Ohio. Claremont County, again, they had at one time been red. They're now red again. Brown County, again, Southwest Ohio. And then over in the eastern part, Muskingum County. Remaining as red counties this week are Cuyahoga, Erie, Fairfield, Franklin, Licking, Lucas, Marion, Mercer, and Montgomery County. 7 of our red counties met fewer than 4 indicators, but are still designated as red. This is because they are above 100,000, more than 100 cases of coronavirus per 100,000 in the past 2 weeks. That is the measure. 100 additional cases coronavirus per 100,000 in the past 2 weeks. Have some good news. Allen and Medina counties are no longer red. And so we congratulate them and just ask everyone to continue to wear the mask and do what they need to do to keep that down. Allen County dropped 2 indicators. They fell off the list for high incidence counties based on the CDC's definition. Medina County also moved from the red alert to orange. They're no longer meeting the emergency department indicator, which is an early indicator. 9 counties have dropped from orange to yellow. They are Adams, Defiance, Fulton, Henry, Knox, Lake, Paulding, Pike, and Williams. Let's talk a little bit about the red counties. We'll start in southern Ohio, southeast Ohio with Brown County. Is red for the first time. 21% of their cases throughout this pandemic have occurred in the last 2 weeks, 1/5. While they've had a couple of outbreaks, the number of cases linked to those outbreaks has been low, which indicates significant community spread throughout the county. Claremont County, we saw cases increase throughout June with about 120 cases a week in early July. This was followed by good news. The community was just starting to see those cases come down as we moved through July, down to under 80 new cases in the 3rd week of July. However, the last 2 weeks, we're seeing cases creep back up. The last 7 days of July had 101 cases. In addition to cases going back up, we've also seen increases in healthcare use for patients with COVID-19. Cuyahoga County, they continue their steady decrease in daily number of cases reported. They're at 102. So if they get below 100, they will move out of the red area. So very good news there. County has reported some outbreaks in long-term care facilities and group homes. Erie County. Erie is red because they meet the CDC's threshold for high incidence. Again, high incidence is above 100. They're at 105 cases per 100,000 residents in the past 2 weeks. They have gone down, and that is good news. Fairfield County, they are above 100. They're at 114. While the county had slightly fewer new cases during the past week, their numbers remain elevated. Franklin County also continues as red this week because they meet the CDC definition for high incidence. Their cases are in fact dropping, but they're still at 126. They dropped from 142 to 126 per capita. Licking County still meets the CDC's definition for high incidence, which kept them red this week. They only met 2 other indicators, cases per capita and percentage of cases in non-congregate settings. Lucas County, 159 cases per 100,000 residents. Of course, they meet the definition of being over 100. Marion County meets the CDC's definition for high incidence. They're at 101, so they're right on the line there, but they're close to dropping off that. So we hope by next week, Marion County cases will have eased down and Marion County will no longer be red. Mercer County, again, as we said, 298 cases, way above anybody else. And that's the news there, unfortunately. So significant community spread is taking place. Montgomery County, cases per 100,000 down to 94. That's been an improvement, but they still remain red this week. While they no longer meet the CDC's threshold for high incidence, they meet 4 other indicators. They're one of 2 counties that had increases in both their emergency department and outpatient visits during this reporting period. Not good news, because what that means is those are the early warning signs that cases are going to start to creep up. So that's not good. Muskingum County, as we said, first week is red. They are at 62 cases per 100,000, but they have other indicators that put them in this category. Again, for them, outpatient visits grew from an average of 4 visits on August 3rd to 9 on August 10th. So that percentage of cases increase is certainly not good. We've tried to share some stories about how the virus spreads. Let me just share a few. In Clark County, a group of friends got together to play cards at a friend's home. Now, sadly, 7 individuals are, in fact, testing positive. We're also continuing to see small workplace outbreaks where one member of the staff spreads it to a group of co-workers. In some of these cases, the businesses have had to close for cleaning or for staffing. We've seen this in New Philadelphia, and we've seen it in Dayton, and we've seen it in other parts of Montgomery County as well. We're going to continue to share these stories, again, not to be critical of anyone, but rather just to explain that these cases are spreading and just kind of common everyday occurrences. When people let their guard down, don't wear a mask, don't do the social distancing, and they can occur among friends, they can occur among family members. Eric, let's go back to another map, and I've asked our data team to kind of combine something from the Ohio Department of Education and the Ohio Department of Health. And so if you will look at the map that is up now, and particularly the one that's on your left, this is a kind of an overlay map. And what we have done, where you see counties in red with the red outline, those are counties that this week are red. Some have been red for a while, some just became red. But these are our red counties this week. Overlaid inside of that, or laid inside of that, is the Department of Education's map in regard to which schools are coming back in person. So let's start with the darkest color on there. See how good my eyesight is, but I would call it dark blue, maybe. Dark blue is fully remote. So these are the school districts that we know of right now that have decided to be fully remote. The blue, what I would call the light blue, is hybrid, which means they're coming back partially in school and partially remote. And the ones that are coming back full-time, their plans to come back full-time, that's sort of a green, if I can read that correctly. And the only point is for everybody from those areas to look. I had some conversations with some superintendents last week. I'm going to have some more conversations this week. And every school is making its own decision about whether to come back and which way to come back. we've had a long tradition in this state of local schools making their own decisions, families making their own decisions, school boards making their own decisions. But if you look at back at the map for a moment, Eric, those that are red and are coming back in person, that is a challenge. And it's a challenge, not so much to the educators, because after talking to a lot of superintendents and principals and teachers, I think they're going to do a bang-up job to do everything they can to keep your children safe, or your grandchildren safe when they go back in school. But I'm pointing this map out kind of for us, for people in the community. We have a job to do. And our job to do is to slow down the spread in the community so the school can either open or the school can stay open. And I just put these counties up because these are the reddest counties. These are the red counties. These are the ones we're seeing right now with the most spread. But it's important. It's an important principle, I think, for all of us, whether we're yellow county, whether red county, whether in orange county. And that is, we have an obligation to do everything we can to slow down the spread in our community so our kids can go to school, our grandkids can go to school, they can play sports, and they can do all the other things that we want them to do, and the things that we want them to get out of a school. On August 4th, we announced that we're going to make an order in regard to kids in grades K through 12 to wear face coverings. I know I've talked to some superintendents who've asked me when are we going to put that up. It's coming up today. So the mask order for all our educators and parents, coronavirus.ohio.gov, that is coming up. Let me now turn to a very important topic of minority health and issues of disparity. In April, we formed a minority health strike force to focus on the disproportionate impact of the coronavirus on our minority communities in Ohio. The group's mission has evolved over the past few months to examine broader health disparities and racial injustices. Today, the group has released its final report. And I want to thank the members of the strike force for their hard work, their passion, their commitment to shedding light on the health disparities just proportionately affecting people of color in Ohio. It is wrong that in Ohio today, the overall life expectancy of African Americans, Ohioans, is 4 years shorter than of white Ohioans. It's wrong that African American Ohioans have a higher rate of heart disease, higher rates of hypertension and diabetes. It's wrong that our African American citizens are 2.5 times more likely to live in poverty, and African American children in Ohio are 3 times more likely to live in poverty than their white brothers and sisters. The coronavirus has further laid bare the disparities. African Americans, who today make up about 14% of Ohio's population, represent 25% of positive COVID-19 cases, 32% of COVID-19 hospitalizations, and 19% of COVID-19 deaths. At least 6% of the people who have tested positive for the virus in Ohio are Latino, although they make up less than 4% of the state's population. We have to do better. We can do better. In my inaugural address as governor, I laid out the ideals that would guide our administration, the values, the principles that serve as a foundation for what we try to do every single day. At that time in my inaugural address, I said everyone, no matter where they were born or who their parents are, deserves a chance to succeed, chance to get a good paying job, chance to raise a family, chance to live their version, whatever that is, of the American dream. Now, to truly make change, we need an equitable healthcare system. We need thriving communities. We need improvements in quality of life. These are things that our health experts call the social determinants of health, things that make up a big proportion and of determining how well we're going to do and whether we're going to be well throughout our lifetime. The Minority Health Strike Force's final report offers 34 recommendations on the topics of dismantling racism, removing obstacles to public health, improving the social and economic environment, improving the physical environment, and strengthening data collection to better track disparities. I ask my senior leadership team, I ask my members of the cabinet to read this report, and they have done so. I've asked them not just to read it, but to lay out a plan where they, in the world they occupy, in the position they occupy, can do better with their own employees, but also do better in whatever mission they have as a member of our cabinet. In response today, we are issuing Ohio's executive response, a plan of action to advance equity. Let me pull this up. So this is what it looks like. You'll have a chance to pull this down online. This is our administration's action plan. It's a beginning. It's not an end. But it's trying to put in writing some of the things that we believe we can do to change things for the better. It doesn't mean it's the end product. It's the beginning. I mean, we started when I was sworn in, but this puts some things in writing and says, these are some additional things that we're going to do, and it will be a work in progress, and we will continue on that throughout the duration of our administration. Because it really is true. All of us can do more. And I'll just give you a few examples. Today, I'm challenging our colleges and universities, and we've got some great ones in Ohio, to come up with ways to recruit more African Americans to become teachers, to become mentors, to be in our school system. Very, very important. I'm challenging the Department of Jobs and Family Services to do more with foster care. Look, our foster kids, particularly our African American ones, spend much too long a time in foster care. They languish in foster care longer than their white brothers and sisters do. And that is not good. If you look at the numbers, it is very sad. While 16% of Ohio's child population is African American, the population of Ohio's foster care system is 31% African American. Among children who stay in foster care more than 2 years, 1/3 of them are African Americans. Again, even though African Americans children represent only 16% of the child population of Ohio. They're not adopted enough. They languish in foster care, and I'm challenging our team to do more about this. We've done some things. We have to do more. We are making a commitment to get kids out of foster care and into homes, black or white, by finding out what the problems are in the system and trying to fix that. The Ohio Department of Jobs and Family Services is reaching out to minorities who have experienced the children's system themselves, the child service system themselves, to better understand their experiences and to work in partnership to develop systemic solutions to this racial disparities. We hope to have a final report on that to share with you by the end of the year. This work will enhance the efforts currently underway by our Children's Services Transformation Advisory Council, which traveled the state last year, hearing from children and families impacted by the foster care system. Collectively, their recommendations will help to reform Ohio's foster care system to ensure better futures for all our children in Ohio. I'm going to turn it over for a moment to Jon Husted. Jon is in Columbus. John's going to talk about an issue that he and I have talked a lot about, and our cabinet is focused on, and that has to do with African Americans who are in business, giving them a better opportunity to grow their business and attracting more African Americans to go into business. Jon?
Yes, thanks, Governor DeWIne. Appreciate it. The economic team, we've been engaged with them through this process, and they are accepting your challenge to do better as it relates to supporting African American businesses and careers in the state. The Jobs Ohio team, the Development Services Agency have been hard at work because we know that health outcomes are tied to economic outcomes. And while Ohio's been a popular place and a great place for innovators and entrepreneurs, we know that in the minority community, potential businessmen and women have struggled to get a foothold. The three keys to success in the modern economy, and I think people widely embrace this, is that it's capital, it's innovation, and it's talent. And these are so important for success in business. This is true in every community, but it's particularly acute in the African American community. We need to do more to improve access to capital, working to get more African Americans involved in financial institutions, and to create, frankly, more minority-owned and operated banks and financial institutions in our state. To promote the development of technology-based businesses in the minority communities, and to focus on technology skill development and STEM skills, because those are critical to having economic success in the modern economy. To deal with the added challenges that are presented by COVID, you will remember that the governor and I announced the creation of the Office of Small Business Relief within the Development Services Agency. And this coordinates resources for small and medium-sized companies during this time. This is a critical time. Some of these businesses are struggling, particularly small businesses, minority-owned businesses, women-owned businesses, and we have to have this proper support there. And they've been working with the Small Business Development Administration, the Small Business Development Centers, and the Minority Business Development Centers to access expertise during this difficult time, to get the market research and the tools that can benefit these businesses. And also, while the Minority Health Strike Force was meeting during this time, we were active in creating the Ohio Minority Micro Enterprise Grant to help create a bridge during the pandemic. This is specifically to provide 500 minority and women-owned businesses with up to $10,000 in grants. We have already received 700 applications, so we know it's popular, we know it's helpful, and that program is moving forward. But Governor, this is just the beginning. I know as we've talked about this, that people have been across the administration have embraced the idea on the talent front, especially to help build more tech skills, to help build more STEM skills, which will serve to create new healthcare job opportunities, which are important when we're talking about minority health, and also new business opportunities. So your team, your economic team is ready to go to work on this, have been at work, and we accept the challenge, Governor, and I'll turn it back over to you.
Good. Thanks, John, very much. Very, very important. In regard to more equality in policing, we've already talked. We took a whole program, press conference, and talked about that. We have laid out to the General Assembly a comprehensive plan that will work, that will make things better, bring about more justice. And I'm asking them today to pass it. It's there. It's good. We've worked with some of the members of the General Assembly on this. It needs to pass. I'm also challenging our Department of Health and in Ohio Environmental Protection Agency to do more to address the lead paint problem in Ohio. I've talked a lot about this in the past. I won't spend time today, but it's wrong. It's wrong. We have to change this. It's crazy that in the year 2020, we still have children who are being poisoned by lead paint. Infant mortality, huge disparity in infant mortality between African-American babies and white babies. Huge disparity in the mortality of the mother. And that both of those simply have to change. We're doing work, but we need to do more, and that is our commitment. One of our commitments today also is the creation of the Governor's Equity Advisory Board. The idea behind this is to have a permanent group working with us, people brought in from the outside, people not necessarily in government, but people who bring a wide array of experiences who can advise our cabinet members and who can advise me in things that we need to do to make this a more just society. This is a permanent ongoing group to help guide us as we address the underlying conditions and root causes contributing to disparities in life and health in Ohio. With me today is Alicia Nelson. Alicia is the director of Recovery Ohio. She was in the Attorney General's office with me, where she headed up what we call our heroin unit. So her work has been, a great deal of work has been in regard to recovery, great deal of work in regard to fighting the opioid epidemic. She's been working directly with the Minority Health Strike Force, and she's here today to talk about our new Equity Advisory Board. So, Alicia, thank you. Thank you very much for being with us.
Thank you, Governor. It's been my pleasure to serve the residents of Ohio through my work on the Minority Health Strike Force. The strike force members have brought great energy and passion to this work, and we're grateful to their contributions and service. Governor, we often hear you talk about action and how important it is to create real and meaningful change for the people in our state. And so I'd like to spend a little time this afternoon sharing one piece of how this work will be implemented. The next step in recommendation 1, or commitment number 1 in the executive response, is to create the Governor's Equity Impact Board. The board will work to improve state efforts to dismantle racism and promote health equity. The board's members will draw on the expertise that currently exists within Ohio's communities of color. African American and Hispanic Americans, Asian Americans who speak a multitude of languages and live within our state will represent diverse viewpoints from sectors like education, healthcare, public and private business, community organizations, and members of the criminal justice community. It will be important for the board to provide continuity to the work we do. It'll also be important for this group to advise the state on how we move forward and utilize all that can be made available to communities across the state to promote wellness in all of our residents and all of us. Finally, and most importantly, the members of this group will hold us accountable to our commitments to address equity. Thank you for the opportunity to share this important work, and I know it'll have a lasting and positive impact on communities of color. So thank you, Governor.
Director, thank you very much. We appreciate your good work. I know you've worked very, very hard on this. Let me also introduce someone who has also worked very hard on this, a member of my cabinet. Ursel, there you are. Ursel, you're there. Ursel McElroy. She's our Director of Aging. She's got, as Alicia does, she has a big job. She's also with me in the Attorney General's office. She headed up our Elder Justice Initiative then. She's been working directly with the minority strike force. She's with us today to really kind of represent our cabinet and to talk about some of the specific commitments that our directors have made. So, Ursel?
Thank you.
Good to have you here, and I'll let you take off and talk a little bit about what you and the members of the cabinet are doing.
Okay, so thank you, Governor, and thank you for the opportunity to be a part of this really critical work. I'm so appreciative to work with such a wonderful cabinet. Every day I'm in awe of their hard work and the transformative ways and ideas that they bring to the table. It doesn't matter if it's midnight, if it's early morning, each of them will certainly answer the call. And they don't only answer the call, they listen and then they act. And I think about some of the work that they've done, looking at our healthcare system, working to make it more accessible, making it more meaningful. If you consider telehealth, the steps that have been taken quickly to enable Ohioans to stay safe and to still receive critical needs met with minimal reduction during COVID. With EPA, our water system and lead abatement efforts, realizing those things need attention, they weren't afraid to take action. Our highways, we knew our infrastructure needed attention and things were overdue. And so we took on that work. And again, I get excited when I think about mental health and the attention we're bringing to those issues. Attention that's necessary for people that have been left in the shadows far too long because of stigma. And Director Hall, working on a benefits bridge to address a problem that has existed for so long. People have been pennies away from having their livelihood cut because of rules. With Director Hall and the Governor, we know that we can do better. And then General Harris, helping in such an incredible way now during COVID, surging into food banks, helping with our nursing facilities, and helping with the civil unrest we've had throughout our state. I could say so many things about members of our cabinet, and I just want people to know that how privileged I feel in working with them. But what's important is I want you to understand and appreciate what this cabinet is willing to do and lean in to do. And so with that, I want to first extend grateful appreciation to members of the Minority Health Strike Force for the report. And regarding the report and our cabinet's response, we know that Ohio's public health entities have long advocated for the basic needs of Ohioans. They have spoken about the impacts of social determinants of health. Social determinants are those things that can contribute to our future health and opportunities. Social determinants are our basic rights, and they extend far beyond our basic needs, and they are complicated. And we know that Ohio's public officials must join together to address the historic decisions that were made. Decisions that continue to have an upstream impact on disadvantaged Ohioans that can begin at birth and years later can result in adverse health outcomes. So, in terms of the report and the initial thoughts of the cabinet and what our agencies can individually pursue, as the governor mentioned, we first came together and we looked at this with a critical eye and with the eye of opportunity. What we understood was that there were areas that we could impact within our respective departments. Our commitments revolve around our people, the state's workforce to drive change. Our commitments revolve around our policy and programs to advance equity in our work and our public service, to achieve more equitable, accessible, and culturally competent public services. And there is work already occurring and work to be done. In addition to the 10 commitments within the response, are actions identified by the cabinet that can make a difference, that are so important to the changes that need to happen. For example, the Ohio Department of Transportation will be focusing on ways to incentivize the ability for transit authorities to provide on-demand transit for healthcare-related trips. And on the internet front, which we all know provides us with opportunities and access, the Ohio Department of Transportation is also working with Innovate Ohio to explore options to expand broadband to underserved areas, with particular focus on rural schools and homes, by placing fiber optic cables in interstate right-of-ways. For public health, the Ohio Department of Health has its State Health Improvement Plan, which we often refer to as the SHIP. And the SHIP provides state and local health departments and hospitals with a menu of strategies to improve the performance on public health priorities. For example, to affect adverse childhood experiences and kindergarten readiness, both which have long-term impacts on health outcomes. The SHIP features strategies in early childhood home visiting and early childhood education. And certainly, I would be remiss not to mention within my agency, the Ohio Department of Aging. We've been working with experts across Ohio to develop a strategic action plan on aging, a plan that we refer to as the SAPA, and it includes strategies that will be implemented around community conditions, including economic stability, housing, transportation, and elder abuse and neglect and exploitation. It focuses on health behaviors, including physical activity and nutrition and access to care, including long-term home and community-based supports and workforce capacity. We know that in all the work that we do, a coordinated approach has to be taken across all sectors to improve and achieve health equity. And so the SHIP and the SAPA, for example, working together, include a cross-sector effort to improve house quality and affordability, including reducing housing cost burden for those most at need. And then I also want to mention one other good example, because there are so many, to demonstrate our commitment. Within the Ohio Department of Rehabilitation and Correction, they have utilized what's known as the Healthcare Effectiveness Data and Information Set, or the HEDIS measures. And they use these to help internally evaluate the quality of diabetic care for incarcerated Ohioans. The HEDIS data set are one of healthcare's most widely used performance improvement tools. This is an example of the type of objective measure that can be used to evaluate performance. So these are just a few of many efforts that are underway or planned. And as the response explains, there will also be a strategic plan and a board. These elements are critical to moving the needle on the systemic issues and complex issues of disparity. Our planning will reveal the most impactful and those factors that we can influence. We know that it will require a major shift, a shift buy-in between all levels of government and among all Ohio communities. But we are up for the challenge. We are up to moving the needle on this critical issue. And I want to say thank you, Governor, for allowing me to represent the cabinet here today, to be able to express the energy, the passion, and the will of the cabinet to move this forward.
Director McElroy, thank you very, very much. I appreciate you and appreciate Director Nelson. Appreciate what you both have done. I know you worked very hard on this, but you know, as we've talked about, our work is just beginning. We have more work to do. The goals that you all put together, I know you both directly involved in writing this, is a beginning, but no one should think that it's the end all and be all. We have more things to do. The group that you're putting together to work directly with you, I think will give you some good, continue to give you good feedback and good guidance, and we'll keep focusing. So thank you. Thank you both very, very, very much. You know, there are racial disparities in this country. There are racial disparities in Ohio. We talked about them. Certainly in health, education, housing, and we could go on and on. There are many causes for this. Certainly racism is one of the causes. Sometimes it's systemic racism, sometimes it's very overt, sometimes it's more subtle. But sadly, in 2020, racism does still exist in this country. We have an obligation to look at these racial disparities and say, that's not right. We have to do everything within our power to deal with this. And it's incumbent, I think, upon all of us to do that. We've talked today about some of the ways that we're trying to do that, but there'll be more things, and this is really is a work in progress. There are racial disparities in so many different areas, in health and education. Racism is a public health crisis, and this is something that we have to work on every day. It really goes back to what I said when I was sworn in as governor, and that simply is our dream should be that every child in Ohio, wherever they live, whatever their background, whatever their race, they should have the chance to live the American dream. And we need to do everything we can to help them have that chance. That's really what our job is. Our job is to help create that opportunity, put them on a level playing field, making sure they get the education that they need, making sure the barriers that are out there that are caused by racism or other barriers are knocked down so that every child has that opportunity. Let me open it up for questions.
Governor, our first question is from Laura Hancock at cleveland.com.
Hello, Governor.
Hello. Hey, Laura. I guess we're switching over. There you go. You're on.
Oh, I think the wrong Laura is muted.
Uh-oh.
Hi, can you hear me?
There we go.
Okay. Governor DeWIne, given the anxiety that President Trump has created for voters about whether the post office can get ballots delivered on time, do you agree with the decision by Secretary of State LaRose to ban election boards from using more than one drop box so that people can deliver their absentee ballots themselves?
Well, first of all, I think Secretary LaRose is doing a good job. I don't have a comment about that particular decision. The former Secretary of State, who is my Lieutenant Governor, may in a moment. But as far as getting ballots in, we have 4 weeks in Ohio where you can get an absentee ballot, and you have to give no reason. You just want an absentee ballot. We've done this for a long time. We know how to do it. I would expect more and more Ohioans this year would be getting their ballots and sending them in absentee. So I think the system will work. People have the opportunity. If they don't want to do that, they can get 13 hours on election day, sort of the old-fashioned way, and they can show up. They also will have opportunities other days to go directly to the Board of Elections and vote directly there. So there's many options for every Ohioan. And so don't believe that we're going to have a problem. I don't feel we're going to have a problem in Ohio at all. We know how to do this. And I think, again, because of the coronavirus, people are going to be more incentivized maybe to do this earlier. And as Frank LaRose said, do it early. Get your application in, and you'll get that early on. You can mail it, and you'll be done with it, and it'll be good. So I don't know, John, do you have anything? I don't know if you're still online here.
Yeah, sure, Governor. I would just remind folks, we know what the rules are. You can request an absentee ballot now. You'll get it a month before the election. You fill it out, mail it in. You have a month to vote without ever leaving home. In Ohio, as always said, it's easy to vote and hard to cheat. The rules that we have successfully run elections throughout the last 10, 15 years and worked very well are pretty much intact. There will be more drop boxes. There'll be a drop box in every county and every board of election. This thing should run smoothly. We should all just focus on making sure that we're being proactive and doing this stuff in advance and not waiting to the last minute. And if we do that, we won't have a problem.
Okay, next question.
Question is from Christian Hauser at WKRC in Cincinnati.
Hey, sir. A temporary injunction has allowed basketball games to be played in Warren County in our area. What's the latest on rules concerning high school football? And do you worry that if you don't come up with a plan soon, you could see a lawsuit against the health orders there and a temporary injunction placed by a judge that would allow football to take place?
Well, let's take the Warren County case. That case is under appeal. Look, this is very different than high school athletes playing. What this is bringing a lot of people in, many from out of state, who will stay a weekend, who will play a number of games with different teams. So you have the intermixing of numerous games going on, and one athlete may be competing in a number of different games for that weekend. That is just not a good idea. I don't know anybody that thinks that's a very good idea from a public health point of view and the spread of the coronavirus. Now, we're going to have an announcement on Tuesday. Lieutenant Governor and I are going to make about high school sports. We've been working with the Ohio Athletic Association, High School Athletic Association, to get it right, to provide guidelines to make it as safe as possible. I have a great deal of confidence in the coaches who are out there. In fact, we're going to set up a call and talk with some of the coaches in the next few days. Hope to talk to all the coaches, because they really have the opportunity, not just in practice and not just in the game, to impress upon their athletes and the young men and women the importance of keeping a distance and being safe. But it's also important what young people do when they're not playing, when they're home, when they're out and about. And so I think that having the coaches focus on that, we always look to our coaches for leadership, and this is in the era of the pandemic. Leadership in fighting the coronavirus is probably their most important job this year. So we'll have an announcement on Tuesday. A little preview. This is a decision that's going to be made by parents. It's going to be a decision that's going to be made by schools. They're going to make those decisions. We're going to restrict the number of fans. We want the athletes to compete. We want the young people to have their season, but we want to do it as safely as possible. And so this will be a little disruptive for some people. But what we want to make sure is that the parents, people who are, mean a lot to that particular child, have the opportunity to see them. And then for the rest of us, we'll have to hear about the game, or maybe it'll be, we can pick it up on the internet, YouTube. But it's about the kids. And so we'll have all the details. We're working out the details this weekend for every one of the sports. So that will be coming. We look forward to Tuesday, and we'll have it done this weekend. Get it done this weekend, we hope, and then we'll be able to announce everything in more details on Tuesday.
Governor, your next question is from Kevin Landers at WBNS 10 TV in Columbus.
Hi, Kevin.
All right, we'll come back to Kevin. Our next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor.
Andy.
On the topic of equity and disparity, when it comes to what the task force looked into, did the group look into the state's current regulations and health orders on businesses to find out if there are enough protections in place for industries that tend to have more people of color as employees? Are there enough protections for those employees in those sectors?
I am not aware that was done. It could have been done. I'm just not aware of that, but that is something that we should in fact look at. So this is something that Ursel and Alicia, the two directors, I know will take with the new group that's starting up, and that can be the first thing to look at. I think it's a good idea.
We'll go back to Kevin Landers at WBNS.
Sorry about that, Governor. After the 4th of July holiday weekend, we saw a spike in cases. I believe it was the highest spike we saw. With Labor Day now 25 days away, what will the state do to protect Ohioans after a holiday like that? And is a stay-at-home order any possibility?
We're going to continue to monitor the numbers. As I look at these numbers every day, there's good news and there's bad news. The bad news is that we got very, very significant spread in some of our rural counties, not in some, other ones not so much. Our urban areas are tending down, but as Mayor Ginther and I were talking this morning, they're still high. They're above 100 in most of our cities, and it's just at a dangerously high level. All it means is the indicators aren't going up, but they're already at a high level. So look, as we go forward with students, let's take Columbus, with students coming back, 45,000 students coming back. That's Ohio State, and then the other colleges and universities in the area, plus K through 12. So, look, there's certainly more opportunity for spread. So the beginning of school creates that opportunity. That's why we've, have been pretty strict in regard to the mask wearing in school, both the teachers as well as the students, social distancing, all of these things. And we're working, I know the schools are working directly with their local health departments to stay very, very close so that once there is an outbreak in one of the schools, that action can be taken. So Labor Day is a ways away, not ready to make any kind of decision about anything else that we would do. We're going to continue to watch things, and again, a lot of it comes back to simply what we do, and there's frankly a limit to what we can regulate. I mean, I would remind everyone that there still is a 10-person limit. Now, there's some exceptions, yes, but if you want to stay safe, wear a mask, keep your distance, use good sanitation with your hands, stay outside as much as you can. And those are all things that really certainly make a difference. But stay away from large crowds, even when those crowds are made up of members of your family or friends. It just is not safe. The virus has spread too much in the communities, and we don't know who has it. That's the nature of it.
Governor, your next question is from Scott Hallis at the Xenia Daily Gazette.
Hey, Governor, how you doing? Thanks for taking my question. So you said an announcement's coming Tuesday regarding sports, but you said there's going to be limited fans, and you're working with the coaches, and the coaches and the schools are going to decide. So it sounds like there will be football. We just don't know to what extent.
Yeah, we'll get more into that on Tuesday, but our goal is to have this decided by parents, number one, and number two, by school officials, local health departments, all of that interplay. And so these are decisions that are going to be made. And again, you've given me an opportunity to say something again, Scott, and that is what goes on in the school and what goes on with the athletes is directly related to what goes on in the community. If you want your son, if you want your daughter to play sports, if you want them to have any other extracurricular activities, whether it is band or whether it's cheerleading, whether it is debate, whether it is speech, whatever goes along with school, all these experiences that are great experiences, the ability of that school to stay open and the ability of your children to play sports is directly dependent on what's going on in the community. And it just is. And so we all just need to be in this together. We want our kids to be able to have that experience, but it won't last. It won't last unless we slow this coronavirus down. And it's not just the red counties. The red counties are the ones on high alert in regard to that. But it's every county. What goes on in that community just really impacts it. And we can control that. We control it. We control it by what we do.
Governor, your next question is from Max Philby at the Columbus Dispatch.
Hi, Governor. I've got a two-parter for you today on masks. One, how will the state enforce mask wearing at polling places during the election this fall? And secondly, when it comes to masks in schools, do children still need to wear them even if they're socially distanced?
The answer to the second one is yes, but obviously there's some exceptions. If your child is outside and they're socially distancing, would not have to wear a mask. I mean, the order, you'll see the order. It'll be out. It'll be online the next several hours, and you will see that. And ultimately, look, this is going to come down to the teachers, and the teachers are going to be the ones who are going to deal with the young child, just as they deal with the child for everything else. Look, as far as polling places, I agree with what the secretary said. We have an order that people wear masks. That applies everywhere, when it fits within the order. So, yeah, people need to wear masks. But we do not expect, and we would not want, anybody who works at the polls to be put in a position where they have to tell somebody, oh, you can't vote unless you have a mask on. We're not going to do that. That is a basic right. Maybe that person who walked in has a reason for not wearing a mask. That's a health reason. But we can't put our poll workers in that position. This is a very, very important right. We would hope that people who go in and vote would be respectful of the poll workers, particularly who are there for 13 hours and longer than that. But they're seeing people for 13 hours. But no, I think. Look, the Secretary of State, I think, is right on point.
Next question is from Jeff Reddick at WSYX in Columbus.
Good afternoon, Governor. A lot of talk today, of course, about health crisis, and we've been talking about COVID for months. This summer in the capital city, in Columbus, we have a crisis of violence, which of course is contributing to health as well. And I know you say many times that you speak with Mayor Ginther here regularly. At the same time, his administration has quite a split with quite a high profile split with the police union here. Does the state have a role in smoothing that relationship? Does your administration have a role in trying to cut down on the violence and the assaults in Columbus?
Yes, here's what we can do. I presented to the legislature as part of our Strong Ohio bill, a very significant part of that bill. It doesn't get written about a lot, but it is something that I believe every chief of police, at least of a major city in Ohio, agrees with, and that is a violent offender, a repeat violent offender, who has long ago lost it's usually his, right to have a gun, when they are found with a gun, in possession of a gun, in absolute violation of the law, the judge should have the ability to put them away for a long time. If we can do that, if we can pass this and give this to our prosecutors and give this to our sheriffs and give this to our police departments, particularly in our cities where we're seeing just horrible carnage, if we can get that passed, that will be a very, very significant tool. It won't solve every problem. But I'll tell you, when you talk to chiefs of police in cities, what they tell you is, we know basically who the repeat violent offenders are. If we could get them off the street, just get them out. And you know, it's usually not a huge number of people. You know, someplace like Lima, Springfield, mid-size, might be 20 people. Might be more than that in Columbus, but it's a relatively small number of people. You get rid of them, and frankly, the violence goes down. And then you don't have 5-year-old children who are killed because they were in the wrong place they had the right to be in their home, but somebody shot and aimed at somebody else and ended up killing the child. So yeah, it's a big problem. We've seen this violence escalate, and we need to solve it. And I've sent to the General Assembly a very, very well thought out provision, and I didn't write it all. Look, we had prosecutors look at it, we had police look at it. It needs to pass. So yes, there is things that we can do.
Next question is from Jesse Balmert of the Cincinnati Enquirer.
Hi, Governor. My question is, why has Ohio not released the number of deaths at nursing homes by facility? It's something that states like Kentucky and even the CDC have provided. I guess, why is this not information that relatives or people looking at nursing homes should have access to?
Well, I thought we were releasing them. And if we're not, let me check and see if there's any legal reason we can't do that. I know we went through this discussion a couple months ago. I thought we were getting information out. Let me see, and I'll report back on Tuesday.
Thank you.
Next question is from Marty Schladen at Ohio Capital Journal.
Good afternoon, Governor.
Hey, Marty.
I want to give you another crack at this notion that a coronavirus bill should have money for state and local governments. A holdup between the White House and congressional Democrats is the Democrats are asking for $900 billion. Do you agree with that ask, or do you think any money should be provided, and if so, at what level?
Marty, I spent 20 years in the United States Congress. I had my chance to be there and to vote and to have an opinion. Let me just talk as a representative of the state and a representative of my friends who run cities and villages and townships and counties. This coronavirus is been devastating to many, many, many people. One of the huge fears I think we all have is that, excuse me, is that the cities are going to run low on money for police. Cities are going to run low on money for fire. These are big concerns. There should be a concern about where we're going to be in the state in regard to education. Look, we made some cuts. We didn't like making them, I'll guarantee you. But we made them because we had no assurance that we would be able to, if we didn't make the cuts, to be able to sustain the level that we were spending. We knew we couldn't. So these are important things. Having flexibility is important. As I look towards the future in regard to what we're going to have to do in Ohio, as I've said, we need to double, and then we need to double again our testing. We've come up 22,000, I think, something like that today. But look, we need to double that, and then we need to double it again. That's not going to be cheap. I mean, we're trying to do as cheaply as we can. We're trying to build our own infrastructure, but that's going to cost money. So look, all those things are important. You know, there's a bill to be had out there. I'm confident that there can be a bill. I think what the president did was the right thing. The president tried to move the debate, and he came out with a proposal and said, hey, you guys aren't going to move, I'll move. And but we all know that executive orders, particularly in this area of spending, are blunt instruments. And it's much better if Congress can do what only Congress can do, and that is pass a bill and get it done. So I hope that they'll be able to do that. We have, basic public services that are at stake. What else is at stake is our ability to test, and these are essential. It goes back to, and if we have to stay on top of the coronavirus. We have to try to keep it down. If it rears up too much, you're going to see what's happened in some of the southern states where the economy starts going back and pulled back because people are afraid. So it all is important, and we need the help, and we need a bill.
Next question is from Molly Coweek at WHIO in Dayton.
Hi, Governor. We've had some local outbreaks in the Miami Valley, most recently 64 cases at a nursing home in Darke County. Are you concerned some of the relaxed visitation rules have led to any of these outbreaks?
Yeah, let me just first say that a nursing home can, in all fairness, they can have an outbreak and still be doing everything right without commenting about any particular case. I have charged our department to again review sanitation, to go back and look at this in the nursing homes. We are now started on a new program of testing. If you remember, we had the National Guard testing in our nursing homes. We now have a new protocol where we're requiring every nursing home basically to do their own testing. That testing has to occur every 2 weeks. Frankly, I would like to get it down to every 7 days, but we're going to start at 2 weeks. And then as we get the capacity up, we're going to do that. What's happening is we've arranged for the nursing homes, basically to do their own swabbing. The Ohio National Guard now, instead of doing testing, the Ohio National Guard is doing the logistics, which simply means, taking those swabs from those samples from the nursing home directly to the lab. And it's very complicated, complex, because we have nursing homes all over, we have labs all over, and it's trying to match them up. And the Guard is doing that. And let me just say to the Guard, you're doing a great job. And we have kicked into that phase of it. So more testing in our nursing home, more testing, more tracing in our nursing homes, more emphasis on sanitation.
Next question is from Laura Queso at WKYC in Cleveland.
Good afternoon, Governor. I'd like to talk about the state mask mandate that went into effect some time ago. Yesterday, daily numbers well above 1,000. Today, 1,178 cases. You mentioned 3 more counties in red today. When you look at those numbers, do you stand by your mask mandate? Do you truly feel it's been effective to this point?
Well, masks are effective, and we've seen a decline in the parts of the state where they've been used the most, and that is our urban areas. We put those mask orders in earlier. We went to the red counties. Most of them at that time were urban areas, and so now we're continuing to see a decline. In fact, we've seen a decline where some of these counties are going off red. We saw the improvement that was made in Hamilton County, for example. We've seen Franklin County come down. We've seen Cuyahoga County come down. So these counties these urban counties are coming down. That's where the mask wearing is the most prevalent. We've seen where the mask wearing is not as prevalent, we've seen these numbers go up. Now, it's not as simple as that. There's a lot more issues, I'm sure, involved, but that certainly is one. So yeah, as Doctor said yesterday, she listed the most important things in order. And you notice the first thing she said was mask. Second thing was distance, and on from there. So yeah, look, we're seeing where these incidents are occurring. We're seeing where people are getting the COVID, and many times it's where people are letting their guard down. They're not wearing a mask. They're not distancing. They're among friends. They're among family, and they kind of let their guard down. So yeah, masks work. We know they work. And when you marry that mask with distance, when you put those two things together, it's a tough 1-2 punch combination to beat.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. I've heard from several teachers and parents in red counties who are concerned their schools are reopening fully. Do you believe if a county is in the red, they should be reopening 5 days a week? And will you be willing to step in if we do see a spike and it seems schools are open in unsafe environments?
Yeah, look, I was asked that question by some superintendents who asked me, will you guarantee that you won't ever go in and step in? I said, look, no, I can't do that. That would be irresponsible. But what we want to do is allow the local community to have their say on this, see how it works. What we've tried to do, and I've done today, and I'm going to do tomorrow, and I do every day, I'm talking to superintendents, but I'm also talking to people out in the communities, is if you're a red county, you got to get those numbers down. The spread that occurs in your county is going to occur in your school. And so that decision, that threshold decision about whether or not they go remote, they go hybrid, they go in person, we're still leaving that with the local school. But we're going to monitor it. We're going to see what's happening. And look, we can see some things in Indiana. Indiana's a little bit ahead of us, a few weeks ahead of us in opening schools, at least in some of their districts. We got to watch what's going on in Indiana. We got to watch what's going on in other states. And then when our schools start to open, we got to watch them very, very carefully. So look, I mean, this is the local communities have historically governed this in Ohio. We're going to let them start. We're going to see how this works. But we're saying to the people in the community, you've got to understand your school is not an island. It's not separate. It is a part of the community, and it will reflect what you're doing in the community. And if you're not wearing a mask in your community, if you're not slowing the virus down, it will not slow down in your school. And look, we got teachers. Young people maybe don't show the COVID, don't have the symptoms many times. But the 50-year-old teacher may, the custodian may, person in the kitchen may. So look, we have a lot at stake. The schools have a lot at stake, and I know everybody in the school knows that. I mean, every superintendent I've talked to has talked about their personnel and their concern about the personnel, and they're going to do everything they can to protect them.
Next question is from Jim Province at the Toledo Blade.
Hello, Governor. Thanks for this again. You've made it clear previously that your face mask order for the general public allows generally for coverings that cover both the nose and the mouth, including bandanas and scarves. But we're hearing from at least one school district that is prohibiting the use of bandanas and neck gaiters. Why is there a difference between what is required for the general public and what is being required in at least some schools?
I would think that that's a decision that's being made by the school. I'm not aware that we've changed any kind of guidance for that. I'll check, but I don't think anybody in health department has changed guidance. I mean, look, what evolves, the science evolves, and I haven't read every single study that's been done in regard to, there are some masks that clearly provide more protection than others, but the experts will tell you, look, instead of getting hung up on which kind of mask and then people not wear any mask, let people wear masks. And they can be homemade, they can be all kinds of things, but it's getting that blockage. What we're seeing in some medical facilities is we're seeing a mask and shields. That medical personnel are wearing a mask, then they're wearing a shield on top of that. So again, we let the local communities work that out. We don't micromanage it down to that level, but everyone wearing a mask will make a difference. Everyone trying to keep the social distance will make a big difference.
Governor, the next question is the last question, and it's from Farnoosh Amiri at the Associated Press.
Hi, Governor. Thank you so much for taking the time today. You stated today that you believe racism is a public health crisis, and you outlined the data that supports that in the last hour. But as we speak, 2 concurrent resolution bills in the General Assembly are being stalled. And do you have planned to make any recommendations to the House and Senate to prioritize that declaration like Michigan has done? similarly to how you mentioned that you're going to prioritize equity and policing to the General Assembly?
Those resolutions, it's been some time since I looked at the resolution or resolutions. I think I only looked at one. You don't have a lot of different things in them. What I said today is what I've said in the past. We have disparities in our communities. They're not acceptable. We have to work on them. I believe that history will judge me, and I will judge myself by what we do. And so, I made my statement today very, very, very clear about what I think about this. And there are these disparities in health. There are the disparities in education. There are disparities in housing and many, many other things. And we have to change that. But what I think I'll get judged by is what I do. And so, it's up to the General Assembly. These are not even resolutions that the governor signs. They're resolutions. But what we're going to be judged by is what we do. And do we do something about racism? And do we speak out against racism? And whether this resolution is the best way to do it or not, I'm going to leave that up to the General Assembly. But I made it very, very clear, what I think about this. And, there are disparities out there that are caused by racism. There are other disparities that are caused by other things. We have to fix them all. Sometimes the racism is overt. Person is racist. Sometimes someone is doing something and they don't even realize it, which is why, again, education and training and some of these things are so very, very important when we're talking about our own employees. So I'm going to leave that up to the General Assembly. I'm the governor. I made my statement about what I think is important, and I think we need to be judged, and the legislature needs to be judged. What do we do in this area? At the end of the year, what have we done? And there's some very, very tangible things that I know I can do in the executive branch, and we will do, and we'll continue to do more. And there's things that the General Assembly can do as well. We look forward to seeing you all on Tuesday. We will talk in more detail about sports and talk about other things. I hope everybody has a good weekend. Thank you very much.
Ready when you are to make sure your space is clean and that you and the ones you care about most